Module 1, Introduction to Habilitative Supports. Module 1 introduces you to habilitative supports and guides you through important information that is the foundation of the service. At the conclusion of this module, you will be able to describe the features of habilitative supports, describe the difference between habilitative supports, respite, and habilitative intervention, define a developmental disability, and list important things you need to know about a child who receives the service. Habilitative supports provides assistance to a participant with a disability by facilitating the participant's independence and integration into the community. This service provides an opportunity for participants to explore their interests, practice skills learned in other therapeutic environments, and learn through interactions in typical community activities. Integration into the community enables participants to expand their skills related to activities of daily living and reinforces skills to achieve or maintain mobility, sensory motor, communication, socialization, personal care, relationship building, and participation in leisure and community activities. In your role as a habilitative supports provider, this definition means specific things. For example, providing assistance means adapting an activity or providing personal help to a participant. Facilitating means providing opportunities to an individual. Integration means inclusion into age-appropriate activities with typical peers. Exploring interests means doing activities selected by an individual and family. And practicing skills means demonstrating skills the participant already knows that were learned in other therapies like speech or habilitative intervention. Habilitative supports, as you have learned, is a community-based service where the goal of the service is to have a child participate in age-appropriate activities with his typical peers. Other services a child might qualify for include respite, which is a service that provides relief to a child's family or unpaid caregiver on a short-term or intermittent basis. The service cannot be provided more than 14 consecutive days at a time. It cannot be provided on a long-term basis or as a daily service that would enable a caregiver to work. It can be used to respond to an emergency or crisis situation or be used on a regular basis to provide relief to the caregiver. A child might also qualify to receive habilitative intervention, which is defined as a consistent, aggressive, and continuous service that is provided to improve a child's functional skills and minimize problem behaviors. The service includes individual or group behavioral interventions and skill development activities. As a habilitative supports provider, you will work with your supervisor and be responsible for things like adapting and modifying an activity so a child can participate in the activity. For example, having the child glue an item on material at Girl Scouts rather than use a needle and thread. You will also be responsible for providing personal assistance to a child who cannot perform a particular skill, like putting on her coat. Another responsibility will be to provide opportunities for a child to use skills she has learned in another therapy or environment. For example, using language skills to interact with peers. It will also be important that you always make sure that a child is participating in environments that are safe, not only from physical danger, but also from people who could harm the child. Another important role of a habilitative supports provider is to model behavior for the child's typical peers and other adults in the community. This means doing things like showing people how a child can participate in an activity, or demonstrating ways to communicate with the child and watching how she communicates with you. Finally, it is always important to be respectful of and to a child and demonstrate to other children and adults how much you value the child's contributions and participation. Each month, you will also be responsible for writing a summary about your experiences and interactions with a child. Your supervisor will give you more information on how to write these summaries. Your supervisor will provide you with the important information you will need to know about a child. You will see some examples of this kind of information in the following slides. Each month, your supervisor will also spend time observing you. This is an opportunity for the supervisor to reinforce you for all the good work you are doing, as well as give you additional strategies for supporting a child. To qualify for habilitative supports, an individual must have a developmental disability. In Idaho, a developmental disability is defined as a condition that appears before the age of 22, may be an impairment such as intellectual disability, also known as mental retardation, cerebral palsy, epilepsy, autism, or a similar condition. The person must also have major limitations in 3 or more of the following areas: self-care, receptive and expressive language, learning, mobility, self-direction, independent living, or economic self-sufficiency. And the person must have the need for individually planned care or treatment that will be lifelong or for an extended period of time. On the next slide, you will see a PowerPoint that will help you learn more about developmental disabilities. Cerebral palsy is a term used to describe a disorder of the body's central nervous system. The central nervous system is made up of the brain and the spinal cord. Cerebral palsy appears in infancy or early childhood and permanently affects a person's body movement and muscle coordination. The majority of children with cerebral palsy are born with it, although it may not be discovered until months or years later. The early signs of cerebral palsy usually appear before a child reaches 3 years of age. Children who have been diagnosed with cerebral palsy do not always have severe disabilities. While one child might be unable to walk and require lifelong care, another child might be diagnosed with mild cerebral palsy and require very little assistance. Things you need to be aware of. A child with cerebral palsy may have other disabilities, such as communication problems, hearing loss, vision loss, seizures, or intellectual disability. A child with this condition may use a wheelchair if he can't walk, or equipment such as a special chair to help him sit, or a switch to help him turn on the TV. A child with cerebral palsy may need not only time to process information, but also take several minutes to plan and perform a particular body movement. Intellectual disability is a condition that includes a significantly below average score on a test of mental ability and by a lack of skills in areas of daily living, like communication, social skills, and self-care. Intellectual disability is sometimes referred to as a cognitive disability or mental retardation. Children with intellectual disability can and do learn new skills, but they develop more slowly than typical children. There are different degrees of intellectual disability, ranging from mild to very severe. Things you need to be aware of. A child with an intellectual disability may need more time to complete a task. A child with an intellectual disability may need to have an activity adapted so he can participate in it with his same age peers. A child with an intellectual disability may or may not have other disabilities. Epilepsy is a disorder of the body's nervous system involving repeated seizures. A seizure occurs as a result of brief periods of uncontrolled and abnormal electrical activity in the brain that causes changes in attention or behavior. There are several types of seizures and behaviors associated with them. Some people with epilepsy may just stare blankly for a few seconds during a seizure, while other people have major convulsions where their body shakes uncontrollably. For most people with epilepsy, each seizure is similar to previous ones. Epilepsy is usually controlled but cannot be cured with medication. Things you need to be aware of. A child who has epilepsy can usually participate in a range of community activities. A child who has epilepsy may take several minutes to recover from a seizure and be fully present. A child with epilepsy may or may not have other disabilities. Autism is a specific diagnosis within a group of neurodevelopmental disorders called autism spectrum disorders, or ASDs. A neurodevelopmental disorder is an impairment in the growth and development of the brain or central nervous system. Autism spectrum disorders are defined by the presence or absence of behaviors in 3 areas: social interaction, communication, and repetitive patterns of behavior. Autism is the most severe form of ASD and is typically diagnosed before a child reaches 3 years of age. Things you need to be aware of. A child who has been diagnosed with autism needs highly structured, intensive, skill-based therapies to develop social and language skills. A child with autism needs to be reinforced for spontaneous communication. As with any child, a child with autism needs to be provided opportunities to explore his interests. Sometimes those interests can be used to start a conversation or connect with a peer. Disability is what a person has, not what a person is. The way in which a child is affected by her disability is as unique as the child herself. A child with a disability is more like other children than she is different in that she wants friendship, has likes and dislikes, different talents and abilities, and something to contribute to her community. Each child you support will have a plan that will be guided by the child's family. Before you meet a child, your supervisor will provide you with important information that will help you in your role as a habilitative supports provider. Here are some things that will be considered when making decisions about where a child will participate in the community. What the child likes to do, what the child does not like to do, what kind of community activities the child's family would like the child to participate in, and how the child will actually participate in those activities. Other kinds of information will include how the family and other people give the child information, such as using objects, pictures, or sign, how the child gives information to the family and other people, and the child's best position for communicating with another person. For example, if the child has a hearing loss, is it better to stand on one side or the other? You'll also get information about how the child participates in favorite activities, what the child does independently, and if the child walks unsupported or uses a wheelchair. You will also learn things like how the child's disability might impact or limit participation in an activity, the amount of time the child needs to process information, such as verbal directions, the behavioral signals that the child is getting tired, or the environmental situations that might trigger the child to become agitated or refuse to participate in an activity. Now we would like to introduce you to Henry, Sara, and Tony. These are all children who qualify to receive habilitative supports. They are different ages, have different disabilities, and live in different kinds of communities throughout our state. Henry is a 16-year-old boy who likes to bowl and go to the library. He lives with his mother and his younger brother Bill and his dog Watson. Henry likes to take his dog for walks in the park where there is a large model of an airplane. He loves airplanes. Henry wears glasses and uses his vision well in most environments. He does have trouble with his depth perception, so he needs someone to guide him up and down stairs and when the terrain changes, like when he moves from the sidewalk to the grass. His hearing is good and he understands most of the things that people tell him, although sometimes he needs to be given more specific directions if he doesn't know exactly what to do. For example, you need to tell him the color of an item, like bring me the red cup versus just the cup. Henry also has tremors. That means that he shakes when trying to do things like use a fork or pick up a glass. When this happens, his mother will tell him to use both hands, or she will hold the item for him. He is currently on medication for his tremors, which does not seem to make him tired or have any other side effects. Henry uses both words and gestures to communicate. Although he uses a picture schedule at school, his mom says that people are not consistent using the pictures, so it is not the main way he receives information. She wants people who interact with him to know that they have to be patient and that he needs time to process what he is told. Although he does understand what people tell him, he will get confused and doesn't always come up with the words to express himself. He sometimes has trouble sleeping, which makes him tired the next day. He will get cranky if he doesn't get enough sleep and sometimes refuse to do things. His mom keeps a record of his sleep habits, so she is able to tell other people when he is tired. Henry is also a good eater. In fact, his mom says he practically eats them out of house and home. He has learned to use money to pay for items he wants to buy. He does not know the denominations of the bills, but knows, with minimal assistance, how to get the money from his pocket, hand it to the salesperson, and put the change back in his pocket. Sara is 12 years old. She lives with her mom, dad, and little sister. She also has a big sister who lives in her own apartment in the same town. Sara attends the local middle school and is in the 7th grade. She enjoys spending time with her family, however spends a lot of time in her bedroom by herself. She does not show interest in the family pets, but really likes the horses she sees in the field next to her house. She likes to ride the bus to school and is independent in getting around the school. She relies on the school bells to prompt her from one class to another. Sara likes to cook and is usually willing to help with household chores, such as setting the table or clearing it before and after the family meals. She does not like the vacuum and will usually run to her bedroom when she sees that it is being taken out of the closet. Sara is blind in her right eye and needs to have items presented to her from the left side. She receives most of her information verbally, but seems to learn best when presented with both visual and verbal information. Sara also communicates verbally, although not well. She often communicates through her behavior. For example, she will say a phrase over and over again when she feels stressed or when she does not want to do something. Tony is 6 years old and lives outside a small town in southern Idaho. His mom owns the local bakery and his father runs the family farm. Tony's favorite thing to do is go with his dad to feed the chickens and play with his cousins. He also likes to listen to country music, dance with his grandmother, go to the park, and swim in the local pool. Tony likes most foods, but it is easier for him to eat if the food is mashed or of a soft consistency. He takes medication to relax his muscles and help him sleep. Tony's family communicates with him by using a combination of words, real objects, some textures, and touch cues. For example, when his mom is going to move him from his wheelchair to his bed, she puts her fingers under his arms and moves her hands up and down several times to indicate that she is going to lift him up. She always tries to give him information about what is going to happen in several different ways. Sometimes she will tell him and give him a touch cue, and other times she will tell him and let him feel an object or a texture that represents the next activity. Tony communicates with other people using facial expressions and some vocalizations. He uses an eye gaze to make choices. His family will hold up 2 items and he will look back and forth between the 2 things and then look at one item for at least 5 seconds to indicate a choice. He makes choices this way both at home and at school. Module 1 introduced you to habilitative supports and gave you information about your role as a habilitative supports provider. It also provided you with information about the difference between habilitative supports, habilitative intervention, and respite care. You learned about the children who can receive habilitative supports and the kind of information that it is important for you and your supervisor to gather so that you can provide a quality service. In the next module, you will learn about how activities are chosen for an individual, a little about the history of services for people with developmental disabilities, and planning strategies for supporting a person in the community.